Good afternoon, everyone. I'm Chris Sorchik, the Executive Director with Capital Area Healthy Start Coalition. We want to thank you for joining us today for our Lunch and Learn series. We do ask that if you're not speaking, to please put yourself on mute. Smoking can have many health effects on pregnancy. Women who smoke have more difficulty becoming pregnant and are at higher risk of never becoming pregnant. Smoking during pregnancy can cause tissue damage to the unborn baby, particularly in the lungs and brain. There are also studies that suggest a relationship between tobacco use and miscarriage. Today, we're going to learn about how tobacco use affects pregnancy and about local resources available to support moms who would like to quit smoking. We do ask if you have questions during the presentation to please go ahead and put those in the chat, and we'll answer all of your questions at the end of the presentation. I want you to please join me in welcoming our presenter, Emily Kohler. Emily started with Big Bend Area Health Education Center, also referring to Big Bend AHEC, which was what I was going to say, in September of 2012. She serves as the Tobacco Program Manager, which includes implementing and facilitating cessation classes and tobacco treatment and dependence training for healthcare students and healthcare professionals. This role oversees the management of the Tobacco Cessation Program and its employees who serve 14 counties in the Big Bend. Additionally, Emily regularly participates in community outreach and partnership meetings. Emily obtained her Bachelor of Science in Health, as well as a minor in exercise science from the University of North Florida in May of 2008. She was a member of the NCAA Student Athlete Advisory Committee, volleyball team, and a track and field team. Her accomplishments at UNF include All Academic, All Conference, All American Honorable Mention, Hall of Fame, Dean's List, and President's Honor Roll. She played professional volleyball in Europe and Florida. She also obtained her Associate of Science in Dental Hygiene from Tallahassee Community College and became a board-certified registered dental hygienist in 2012. Emily has a lifelong passion for health and health education. Wow, Emily, you are well accomplished. And thank you so much for joining us today. I'm going to turn this over to you.
Absolutely. Well, welcome everyone, and thank you for having me. If you give me just a moment, I'm going to share my presentation. And just confirming again, you only see the home slide, not the notes. Okay. All right. Well, as she said, everyone can hear me okay, yes? Awesome. We're going to cover the effects of tobacco use and vaping during pregnancy today. And I am Emily Kohler. As she mentioned, I'm a registered dental hygienist. I'm also a certified tobacco treatment specialist and the tobacco program manager here at Big Bend AHEC. So today I'm going to cover some tobacco use data and start out by moving the picture of everyone because you're blocking my notes. Let me get that up here. Okay. Yeah, so we're going to cover the impact of tobacco use during and after pregnancy, electronic vape products, which you may hear me term many different things, vapes, EVPs, e-cigarettes, but we're going to talk about the substances that are typically in them, as well as any diseases that may be caused by them or even exacerbated, and then the community resources that are available for tobacco cessation with a little bit of a focus on pregnant mothers. So I always like to start out with general data first so we can better understand the scope of tobacco use in the United States. 11.5% of adults are current cigarette smokers in the US. And while that number is down from almost 21% in 2005, it still represents over 28 million people. Historically, our males have smoked more than females and much higher rates. And though the gap is closing, cigarette smoking was still higher among women recently. And among adults who have ever smoked daily, 87% had tried their first cigarette by the time they were 18 years of age, and 95% had tried by age 21. So most everyone really starts by age 21 or younger. And I would say anecdotally that most of my clients in the cessation classes are, between like 12 and 16 in most cases, which may sound shocking, but it's very common. Those between the ages of 45 and 64 have the highest prevalence of smoking, and the younger population rates are lower, I believe, due to the education and knowledge that we now have about the harms of tobacco use, but also if they're using tobacco products, they're vaping, and that's not what we're looking at in this data right now. The oldest population may have a lower prevalence because maybe if they smoked lifelong, they didn't make it to age 65, and or that population has already quit. We do know that smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer, as well as several other health conditions. And every year, 480,000 people die prematurely from smoking or exposure to secondhand smoke. That's 1 in 5 deaths, or 1,300 deaths per day. It's important to know that people don't always die from tobacco. More than 16 million Americans live with a smoking-related disease. And for every person who dies because of smoking, at least 30 people live with a serious smoking-related illness. While we said 11.5% of adults are current smokers in the U.S., it's important to note that there are disparities, with the greatest being among those who have lower education levels and those who have behavioral health conditions. Other notable disparate populations are those on Medicaid or have disability, or those who have low socioeconomic status or low income, and those who are divorced, separated, or widowed. So I've included a chart of adults who smoke by racial or ethnic group over the past several years to display changes if there were any. And one thing I wanted to point out is while the white and Black populations smoke at a similar rate on any given year, the Black Americans are more likely to die from tobacco-related diseases. Tobacco use is a major contributor to the 3 leading causes of death among Black Americans, which are heart disease, cancer, and stroke. And then diabetes is the 4th leading cause of death among Black Americans. And it's important that the risk of developing diabetes is 30 to 40% higher for cigarette smokers than non-smokers. And there's the data listed at the bottom where this came from, but 7.1% of women reported smoking anytime during pregnancy. The prevalence of smoking was highest among women who were 20 to 24 years old. U.S. statistics show that up to 40% of women quit smoking during pregnancy, but more than half of those relapse within 6 months and 90% relapse within a year. So they really have trouble remaining quit. And this is relatively common across the board too, because 2/3 of smokers report returning to smoking due to stress. And of course, when you go through pregnancy and give birth, that can be very stressful in and of itself. Never mind, maybe postpartum depression or other, just the stressors of raising a baby. So these are very significant statements about tobacco's impact on pregnancy. So I'm going to make sure I kind of read them off mostly, but tobacco is the human development toxicant and teratogen with the greatest overall adverse impact on development in our population. I was curious if anyone here did know what a teratogen was, if you could rattle that off. Feel free to unmute. I'll give it a few seconds. If not, that's okay. So a teratogen is an agent that causes an abnormality following fetal exposure during pregnancy. So basically can cause birth defects. Smoking is the most modifiable risk factor for poor birth outcomes. And if it's modifiable, this means it's a risk factor that can be controlled or changed, and we can have an impact on that. Quitting smoking is the most important action a pregnant woman can take to ensure the health of her baby. Smoking cessation at any point in gestation is going to benefit the pregnant woman and the fetus, but the greatest benefit will be observed with cessation before 15 weeks of gestation. According to the U.S. Surgeon General, eliminating smoking during pregnancy could prevent 10% of all infant deaths due to perinatal conditions. Here we have a study of maternal events for antepartum hospitalization that compared smokers to non-smokers, and they found higher rates of many health events or conditions which are listed before you. Also, smoking doubles the risk for abnormal bleeding during pregnancy and delivery. Smoking can affect the bone health of the pregnant mother. And women past childbearing years who smoke have weaker bones than women who never smoked. And they are also at a greater risk for broken bones. Some of the pregnancy complications from smoking are listed, and we're going to cover them in more detail on the next several slides, so I won't read them off yet because you'll hear each one. So the preterm premature rupture of membranes, or PPROM, is when the amniotic membrane surrounding the baby ruptures before 37 weeks of pregnancy. Nicotine causes a reduction in placental blood flow, which can lead to this PPROM. There's an acute decrease in uterine blood flow after nicotine infusion, meaning like when someone smokes and it saturates in your through your lungs into your bloodstream. And this is due to vasoconstriction and carbon monoxide that reduces membrane oxygenation. And vasoconstriction just means where your blood vessels are narrowing, they're tightening or constricting. So smokers have decreased levels of serum B12, glucose, amino acids, and fatty acids that also may contribute to membrane rupture. Smoking affects fetal nutrition, which compromises the amnion, a vascular structure dependent upon amniotic fluid for maintenance, which results in PPROM. And then smokers have more than a twofold increased risk of PPROM and an increased risk of infection and premature birth. In placenta previa, the placenta attaches low in the uterus and might partially or completely cover the cervix or the opening of the uterus. Placenta previa can cause severe bleeding in the mother before, during, or after delivery. The placenta grows in the uterus and it supplies the baby with the food and oxygen through the umbilical cord. And this is also important just to think about how if that's really good at bringing oxygen, nutrients to through the umbilical cord to the baby, anything the mother uses, whether good, bad, or indifferent, is also going to the fetus or baby. But placental abruption is a serious condition in which the placenta separates from the wall of the uterus before birth, and the mother can experience things like rapid contractions, uterine pain, irritability, tenderness, maternal blood loss, a need for blood transfusion, blood clotting issues, maybe hemorrhage. But the overall incidence of placental abruption is quite low at 1%. But in one study, smoking was associated with a 90% increased risk of placental abruption. So a strong association there. In another study, cigarette use was associated with a 2.5-fold increase in severe abruption, which resulted in death. Ectopic pregnancy is when the embryo implants outside of the uterus in the fallopian tube. And smoking reduces the production of a gene known as BAD, B-A-D, which is involved in the control of cell death or apoptosis and encourages the embryo to implant in the fallopian tube instead of the womb. And this is due primarily to cotinine, which is a breakdown byproduct of nicotine. And cotinine directly harms the genes associated with cell death. The first few days of conception are highly susceptible to genetic damage caused by cigarette smoke. Chromosomal problems are the most common cause of miscarriage, and toxic cigarette smoke can play a role in this. Smoking affects the lining of the uterus, which makes it difficult for a fertilized egg to implant. Nicotine, as we said, is a teratogen, and carbon monoxide, which is a poisonous gas, both rapidly cross the placenta and concentrate in the fetus, resulting in 10 to 15% higher fetal concentrations than maternal concentrations. Decreased uteroplacental blood flow and the presence of carboxyhemoglobin in the blood, which is also a very complicated word, but I'll try to say it, carboxyhemoglobinemia, results in fetal hypoxia and malnutrition. Smoking during pregnancy also causes fetal growth restriction, so smaller babies. You're born with all the eggs. This is really interesting to me when I found this, but you're born with all, and you maybe knew it. You're born with all the eggs you'll ever produce, and a mother who smokes during pregnancy can damage the DNA of their future grandchildren. That just literally it's mind blowing to me. So there are marks made in a process called methylation, which is an alteration of DNA that can inactivate a gene or change how it functions, which is how it can turn on or cause cancer and other diseases. They found smokers had a pattern of methylation changes affecting more than 7,000 genes, or a third of known human genes. Many of the genes had known links to heart disease and cancers known to be caused by smoking. So the risks to the baby after delivery. When a mother has used tobacco during pregnancy and or continues after delivery, it poses many risks to the baby after birth. 1 in 5 babies born to mothers who smoke during pregnancy has low birth weight compared to about 1 in 12 overall. Premature babies can have difficulties with feeding that may even require a feeding tube, breathing problems right away or breathing problems that last into their childhood, cerebral palsy or brain damage that causes trouble with movement and muscle tone, developmental delays where the baby or child is behind in language, thinking, movement skills, and even problems with hearing or eyesight. Premature babies may need to stay in the hospital for days, weeks, or months. Not only is this very scary and stressful, it's costly as well. And low birth weight babies are more likely to die within the first 2 years of life. The risk of having a baby in the smallest 5 to 10% of birth weights is as high as 2.5 times greater for pregnant smokers. And the babies whose mothers are, babies whose mothers smoke are about 3 times more likely to die from SIDS or sudden infant death syndrome. And this is the leading cause of infant deaths. A mother smoking affects the baby's lung development and increases the risk for many respiratory issues, since the lungs are one of the last things to develop during pregnancy. Smoking raises the risk of birth defects, including cleft lip and cleft palate, or both. The cleft is just like an opening in the lip or the palate of the roof of the mouth. And they may need surgeries to repair that, because sometimes it actually impairs like how they could eat or breathe. They could have trouble eating properly. And then also smoking appears to be associated with small increases in major birth defects that involve the heart, the great vessels, limbs, skull, genitourinary system, the feet, the abdominal wall, small bowel, and their muscles. Included in this list are direct effects of in utero tobacco exposure, as well as environmental or secondhand smoke exposure. There's a strong association between smoking during pregnancy and SIDS, independent of that environmental exposure. Other risks to children of parents who smoke are respiratory infections and conditions. Ear infections are common, colic, elevated blood pressure, childhood obesity, development of type 2 diabetes, leukemia even. And the brain develops starting in utero and continues all the way through age 25 years old. And exposure to nicotine, the teratogen, again, I'll keep mentioning that word, causes cognitive, emotional, and behavioral problems, as well as greater risk for them to have addiction later in life. So the message for the mother is, like, if you can't quit for yourself, please consider quitting for your baby. I've included a map of resident live births to mothers who smoked during pregnancy during 2022. And this is a chart of the 14 counties we serve are highlighted out to the side, And I just kind of noted as I looked through that Holmes and Washington had the highest rates of mothers who smoked during pregnancy. And then Jefferson and Leon had the lowest. So go Leon. So we're kind of switch gears a little bit into some of the vaping data and going into all of that. So this is a graph of the percentage of adults age 18 and older who currently vape by age group and sex. So like cigarettes, males use electronic vapes at a slightly higher percentage than females. And not surprisingly, the age group making up the largest current use are 18 to 24 years old. So let's talk about what vaping is. There's a lot of misconceptions, and I'm going to try to clear some of that up today. So it is the act of inhaling aerosol, which we often hear people think it's vapor, and that's incorrect. There are a few reasons, why it would be called vaping. first of all, I always say like aerosolizing doesn't roll off the tongue very easily. But the main reason is really industry driven. They want consumers to perceive safety. So when you hear water vapor, what are some of the things that come to mind for you? What do you think of? You can come off mute. Don't worry, I won't. Water vapor, I can help if you're not blurting them out. So like your boiling water, a steamy shower, a humidifier, you steamed your vegetables. And then when you say just vapor, even you think of maybe some of the health products used when you're sick and you're trying to feel better, like Vicks Vapo Rub, which is soothing throat irritation and coughing. So again, it's this message of the tobacco industry tying in products associated with, safety or making you well. And I think it's really important to understand how vapor and aerosol differ. Excuse me. So vapor is a cloudy diffuse matter suspended in the air, like mist or steam, and there are not very many particles in it. But aerosol is a suspension of many tiny particles of liquid, solid, or both within a gas, like fog, dust, haze, smoke, smog, and they all leave a residue behind that can be harmful. And that's the huge characterizing difference in what makes it a dangerous thing to inhale. Think of just a more simple analogy, I guess, is to think of spraying water from a bottle onto your hair versus hairspray. When the water is sprayed onto your hair, it leaves your hair feeling the same as it did before you sprayed it once it's dry. I.e. there's no residue left behind, but when we spray hairspray onto the hair, it feels stiff once it dries. So there's been a change that occurred, and that is because there is aerosol residue left behind. And likewise, when you're around someone who's vaping, you're breathing in the secondhand aerosol residue. And I don't know if you've ever been in a vehicle where someone vapes, but if you go like this on the windshield, you'll see like a film remove. And you'll understand better in a few minutes what exactly that is. But again, that film, if it's on the things around you, it's also in the body and the lungs. So, let's talk about the electronic vape products out there. There's just so many, and we just can't even keep up with how often they're changing hardly. But more than 460 different brands currently on the market. And it can be really challenging to have current data because of the ever-changing landscape of them, and also trying to shift over and get ahead of all the laws as we try to catch up. Then they're skirting that with new products. So much less just having current data in general, much less is going to be on the effects of pregnancy. We do know that nicotine is a teratogen, and most vapes contain nicotine, so we know that's not safe. And we have to make some inferences for now. So most e-cigarettes consist of 4 different components, which include the cartridge or reservoir, pod, depends on the product. This holds the liquid solution. Some people call it juice, e-juice, e-liquid. This contains varying amounts of nicotines, flavorings, and other chemicals, which we will cover today. Another component of the e-cigarette is a heating element, also known as the atomizer. And then there's a power source, which is usually a battery, and then a mouthpiece that the person uses to put in their mouth and inhale through. So it's important to me to talk about the potentially harmful substances that can be in electronic vape products. Nicotine and water are not the only things in the cartridge holding the e-liquid, which is the message that was initially stated, and maybe some people still believe. It is just a false narrative to get the perception of safety. So even so, I don't think breathing in a high volume of tiny water droplets repetitively would be safe either. At what point do you call that aspirating or micro aspiration occurring constantly, which can do damage to the lungs in and of itself? Many electronic vape products include a mixture that also contains substances and other chemicals that are potentially harmful. So we're going to discuss that over the next several slides. The first substance in vapes that we're going to cover is the nicotine. This is also in other traditional tobacco products. It's an insecticide as well, and it is the addictive substance in all tobacco products. When a person vapes nicotine, it is readily absorbed from the lungs into the bloodstream, and when it enters the bloodstream, it stimulates the adrenal glands to release the hormone epinephrine, or adrenaline, you probably better know it as. The epinephrine stimulates our central nervous system to increase our blood pressure, our respiration, our heart rate. So sort of like a stimulation of ramping everything up. And as with most addictive substances, nicotine activates our brain's reward circuit as well, increases levels of many neurotransmitters, but the primary one being dopamine. That's the reward chemical. It reinforces rewarding behaviors very strongly. We work with substance use disorder recovery clinics, and many of them have been able to quit other substances and struggle with quitting nicotine because it is proven as addictive or more addictive than heroin, cocaine, and other illicit drugs. So the pleasure caused by nicotine's interaction with our reward circuit, coupled with withdrawals that people go into shortly after stopping use, it motivates them to continue to use this again and again, despite all the negative risk or health effects that we know. And as we previously discussed, nicotine is particularly harmful to developing brain by exerting neurotoxic effects in the prefrontal cortex, which interferes with adolescent cognitive development, executive functioning, and inhibitory control. In layman's terms, that means they don't make very good decisions in teenage years because their brain is still developing. And by using nicotine, they can stunt this permanently and make it more likely that they make poorer choices lifelong. Electronic vapes containing nicotine are a health danger for a pregnant woman and her developing fetus. That's the stance we currently are at this point. So particulate matter is a mixture of solid particles and liquid droplets found in the aerosol that's inhaled from vapes. And some particles are large or dark enough to be seen with the naked eye, but others are so small that only an electron microscope can detect them. And the image there shows you the size difference of the different parts and how small the particles can be. They're even termed as ultrafine particles, and they can be inhaled very deeply into the lungs, causing damage to the respiratory and cardiovascular system, as well as the ability to deliver nicotine so effectively and saturate the lungs. The electronic vape product liquid or aerosol contains the base constituents propylene glycol and glycerol. So propylene glycol produces that visible aerosol or cloud that's seen. It's also used in artificial smoke and antifreeze. It causes eye, throat, airway irritation, and as can the glycerin-based oils, which are also often contained in the liquid mixture. And it says that these products have other, common uses as food additives or ingredients in cosmetic products, and lists the different ways that they may be used or why they're in those products. But I'm reading the list and thinking, I'm not sure that I want those in my lungs. So the glycerol, also known as vegetable glycerin, is an oily hygroscopic liquid with a warm, sweet taste. So this is also what leaves that film on the windshield I was talking about, but the warm, sweet taste, it makes it more palatable, likable for the person to inhale. When glycerol is heated, it forms something called aldehydes, like acrolein and formaldehyde, which you are familiar with as embalming dead bodies. So a toxic chemical that you definitely would not want to inhale. So the aldehydes are carbonyl compounds found in electronic vape aerosol. They are cancer-causing chemicals that can be absorbed by the respiratory tract. They're addictive like nicotine because they also create alcohols that are absorbed in the brain when they're heated. And the higher the heat, the higher the aldehyde level created. So some of these vapes have modifiable voltage, so you can turn it up, the power up, the voltage up to deliver like a harder, heavier hit that increases the toxic chemicals as well. So they also potentially cause cardiovascular disease. Formaldehyde, we know, is a chemical used to make resins and preserve, as I mentioned before, and it causes leukemia and cancer in respiratory tissues. Acetaldehyde is used in the manufacturing of acetic acid, perfumes, and flavors, and it causes irritation of mucous membranes. Large doses could even cause death from respiratory paralysis. All right, we're going to talk about flavorings next, which are really quite interesting when you hear some of this information. So the chemical flavorings in the e-liquid may not be toxic by themselves, but some become toxic when they're mixed with other chemicals and when they're aerosolized. According to a study published in the journal Nicotine and Tobacco Research, the flavor aldehydes diacetyl, cinnamaldehyde, benzaldehyde, citral, ethyl vanillin, and vanillin rapidly react with propylene glycol and glycerol to create compounds called acetyls after mixing. And acetyls irritate the eyes, mucous membranes of the respiratory tract, and repeated exposure can cause headaches, dizziness, drowsiness. And in some laboratory tests, a separate research team exposed white blood cells, which are essential to our human immune system, to common e-liquid flavoring chemicals and a typical e-liquid mix without nicotine. So no nicotine, these are just the flavorings, and the mixed chemicals cause significant inflammation in the cells and even killed some of the cells. Cinnamon, vanilla, and butter flavoring chemicals were the most toxic, but the research showed that mixing these flavors of e-liquids caused by far the most toxicity to the white blood cells. E-liquid also contains VOX, or volatile organic compounds. In particular, we're going to talk about benzoic acid. This is the primary ingredient for making nicotine salts, used in many vapes, easier to inhale. Benzoic acid has a role in antimicrobial food preservation or preservative, but it is not meant to be inhaled into our lungs. In comparison to freebase nicotine, I don't know if you've heard the difference between freebase and nic salts, but nic salts absorb faster into the bloodstream. They deliver a smoother, more satisfying hit. And this one phrase came right off of a vape site. It said that it is perfect for beginners, as if they're not targeting youth. And nic salts is best suited for the pod-based vapes and is more constrained cloud production. And this made this, appealing to youth because they wanted something they could conceal somewhat and from, adults and teachers and parents and things like that. So the devices are discreet, less harsh, highly addictive vape products, and they're in the hands of our youth as well as young adults. You know what? We knew cigarettes were not safe, so the tobacco industry had to come up with a product to addict a whole new generation and continue to make money. That's really the reality of what it is. So exposure to benzoic acid can cause eye damage, irritation of the skin, resulting in rash, irritation to the nose, throat, and lungs if it's inhaled, which may cause someone to have coughing, wheezing, and shortness of breath. And then the e-liquid also contains heavy metals that have been linked to cancer, lung disease, gastrointestinal, and brain disorders. The more metal parts there are in a vape product, the more heavy metals found in the aerosol it produces. So typically we'll see this in like those bigger tank style. If you Google this, you can see all types of videos of the metal coils and the parts of people, and they have to replace those. And if they replace them, it means it broke down. If it broke down, where did it go? Potentially you're inhaling the tiny particles of it into your body. And again, we have the same issue of the ones that have the voltage that can be turned up. The concentrations of metals increase with the increased voltage. Another substance found in the vape product liquid are something called tobacco-specific nitrosamines, and these are TSNAs. So although the TSNA levels are significantly lower than those found in cigarettes, e-liquid still contains these carcinogens. And a carcinogen means it cancer-causing, stimulates cancer cell growth. I'm just personally of the mindset that it really only takes one carcinogen to potentially do harm. So I do not want to expose myself and much less my fetus or baby to a carcinogen or teratogen. And here we have, there was a study on electronic vape products found that using them raised someone's risk of developing long-term lung disease. It was linked to diseases that included asthma, COPD, or chronic obstructive pulmonary disease like bronchitis and emphysema, as well as something called bronchiolitis obliterans, which I'll talk about in greater detail on the next slide. But the bronchitis, itis is inflammation of whatever we're talking about. So in this case, it's the bronchioles. And those are your major airways. Emphysema is destruction of the alveoli. They are the air sacs. They don't exchange the gases properly anymore when you have emphysema. And we see these in long-term cigarette smokers, and we're already starting to see it in vape, people who vape. So they're at an even higher risk of developing, those who use both vapes and cigarettes are at an even higher risk of developing lung disease or heart disease compared to someone who only vapes or only smokes. So when we see this dual use, we're increasing some of the chances for lung function impairment. Other studies confirm that vape use weakens the lungs' immune response to infection, making it harder for the lungs to fight off harmful viruses and bacteria. All right, I mentioned the bronchiolitis obliterans. It is a condition, inflammatory condition of the bronchioles. It's in scars and blocks the airways. And it's best known as popcorn lung. Has anyone heard of that before? And do you know why it's called popcorn lung? I had heard of it. I didn't understand. I totally had this wrong. I thought maybe it looked like popcorn or something, but actually, I'll explain just the bronchiolitis obliterans is being researched with respect to vapes due to two specific chemicals, one of which is diacetyl, found in certain vape liquid flavors. And diacetyl is approved actually as something called GRAS, generally regarded as safe for ingestion. So you may see it as a chemical listed to be eaten and think, oh, well, if we can eat it, then it's safe, right? It's different when you inhale it. And these are in very small quantities too, that it's approved to be ingested, but it's definitely not proven safe for inhalation. In fact, it's quite the opposite. One study found that of 150 sweet flavored e-liquids, 69% contained diacetyl and 47% contained diacetyl at concentrations above the National Institute for Occupational Safety and Health Safety levels for occupational exposure. That's dangerous. We shouldn't have this chemical in there. Another study had similar results, finding diacetyl in 39 of 51 tested electronic vape liquid flavors and finding diacetyl in products from 2 companies that had specifically listed that it wasn't in there. So they need a little bit more regulation and testing on these products as well. The signs and symptoms of bronchiolitis obliterans are dry cough, shortness of breath, wheezing, fatigue, crackling or rattling sounds in the lungs. And while there aren't any current long-term studies that link vapes to bronchiolitis obliterans, the current data more than supports that diacetyl inhalation is the most well-known cause of artificial flavoring-induced respiratory disease. It makes that buttery flavor essentially in the vape, so that's why it's used in there. Scientists have discovered that vape aerosol can impair the function of blood vessels by making them stiff. The stiffness can decrease blood flow throughout the body and lead to blood clotting, and the damage can even occur from using or breathing secondhand aerosol from vapes. I thought this was really interesting. It's a super small study, which I wish they could hope they can reproduce this. But in this study from the University of Pennsylvania School of Medicine, they had 31 men and women with an average age of only 24. They took 16 3-second puffs of aerosol from a nicotine-free vape, so no nicotine. Before and after the vape session, each person's femoral artery, so in their thigh, was compressed in the upper leg for a few minutes and then released while an MRI machine monitored that artery. So the constriction, think of it, was similar to the cuffing of a blood pressure test. And when the cuff relaxes, the artery expands. If the vascular system is healthy, blood surges to replace oxygen and nutrients to that limb where it's been denied. But this study found that after vaping, the femoral arteries expanded 34% less on average due to reduced blood flow. And this is, again, non-nicotine. Throw nicotine in there, I imagine this gets worse. The effects suggest damage to the endothelium or lining of the blood vessels, and it lasted for about an hour. So I thought that was a pretty profound result. Here we have using electronic vape products during pregnancy, not safe, as is, smoking, not safe. Just a misconception that this is a safe alternative here. And most electronic vape products contain nicotine, which permanently damages a baby's developing brain and other organs potentially. E-cigarette liquids also contain the chemicals we talked about, flavorings, additives that might not be safe for the fetus or baby. And as we know, it is well known that smoking cigarettes during pregnancy can harm women and their babies. Research suggests that pregnant women who vape believe that using vape products are less harmful than smoking cigarettes. Pregnant women often don't know if their electronic vape product contains nicotine even. And some might use vapes during pregnancy because of the perception that the device can help them quit or reduce cigarette smoking. However, vapes are not approved by the FDA as a cessation device. So that message is out there being perpetuated by the industry who wants them to buy them and use them to become addicted to them. While the use of vape products might expose a growing baby to fewer toxins compared to those with a regular cigarette, nicotine exposure of any kind is still harmful to the baby. And some people say, well, isn't it safer? They ask me in class, and I say, I mean, you're asking me if something is safer than the product that kills 500,000 Americans nearly every year. I don't think that has a lot of weight or clout to say that it might be safer than that. It's still potentially doing harm, is what, you know, someone needs to understand. This is the poison. This is from the a National Poison Data System, American Poison Centers, sorry. And the Poison Center began receiving calls about e-cigarette and liquid nicotine products in 2011, but this data, so they started getting calls in 2011, which coincides with when vapes became more popular, really mainstream in America. But they had over 48,000 exposure cases about e-cigarette devices since that time, as of January 2024. The bad news, the Center for Disease Control and Prevention report that more than half of those calls related to the vapes were regarding incidents involving children 5 years age or younger. Nicotine is highly toxic, particularly through the dermal or eye contact, through ingestion as well, and it doesn't take a whole lot to be lethal. About 60 milligrams for an adult or 10 milligrams for a child. And we have to consider looking at this as a liquid measure when we talk about vapes, which can be challenging when it's not consistent. But the estimated amount is that 45 milliliters of e-juice has enough nicotine to be lethal to nearly a dozen children. So definitely not safe to leave around, leave accessible. It should be stored away. Hopefully that message is made clear when someone's purchasing that product, and they may be completely unaware how dangerous this could be to a child. There are a number of symptoms you want to watch out for if you're worried about possible nicotine overdose. Many listed here. It's in the first like 15 minutes, there's symptoms that create stimulating effects, like they're vomiting, their stomach, their mouth is watering, their heart rate's going up, blood pressure is up, heavy breathing, confused, anxious. And then when it's a little bit later into these symptoms, it kind of shifts, and it's like they're having diarrhea, they're shallow breathing, slow heartbeat, low blood pressure, extreme fatigue, weakness, unable to control their muscles maybe, and even pallor or pale skin. And I'm going to shift into like, okay, now we know all these negative things that I've kind of just spat at you very quickly, and there's so much more to it that I'm not able to include, like starting with how it impacts fertility for females and males, but there's just so much more information. But let's talk about how we can help them. Studies show that brief advice from a clinician about smoking cessation, or really we should be saying tobacco cessation, because sometimes you say smoking and people go like, I don't smoke, but they may vape, or they may dip, or use snuff. And if you have this intervention to help them using the 5 A's, which is ask, advise, assess, assist, and arrange, it yielded a 66% increase in successful quit rates. So you really can make an impact, and how you discuss tobacco use definitely matters. So some of the community resources are listed here. I know Healthy Start has done Let's Talk About Tobacco, and Script for pregnant mothers. I'll go into greater detail about Tobacco Free Florida resources, because those are ones you may not know as much about, because they're for the general public, but pregnant mothers can also use them. And then there's Healthy Baby initiatives in some of the counties, as well as other programs that provide incentives for the patients and or the fathers even, who or the other people in the home, or spouse partners, I should say. If they use tobacco and attend the programs, they can get incentives sometimes, like the stroller, pack and play, diaper bag. So different counties are sort of doing different things, but it's an awesome incentive to get people to come. So Tobacco Free Florida Quit Your Way has services for Florida residents, and they are phone quit, where they talk one-on-one to a quit coach, get 24/7 access to that coach, 3 personal individual coaching sessions. This is free. It's for Florida residents, must be 18 or older to get nicotine replacement therapy. Youth can utilize this program, but they cannot receive nicotine replacement therapy because it's contraindicated. So then they have the Web Quit services. This also offers, when I say they, I mean Tobacco Free Florida, and RVO is the specific company who executes this for them, but they have access to the Quit Coach tools, tips, support to help them, free online, social media and blogs, and they make a tailored quit plan to help them at their own pace. They get the replacement therapy for free if they're 18 or older. Again, youth could use this program, but they cannot receive nicotine replacement therapy. And then group quit, how it really differs. This is what the AHEX do for Tobacco Free Florida. It's face-to-face or virtual, but it's a group setting typically. I say typically because sometimes we have multiple people enroll and only one shows up. But in most cases, it is a group setting. They get free replacement therapy and counseling, and they're eligible to participate in each of these programs I've named 3 times in one fiscal year. Our fiscal year runs July 1st to June 30th. And the classes that we currently offer through the AHEX with Group Quit is they're evidence-based. They've been around for quite some time. The flagship was actually Quit Smoking Now. It used to be 6 weeks. Now it's 4 weeks, 1 hour per week, which is called a multi-session class if someone feels they need additional touch points and counseling. That is a good selection for them. There is also the one-time class. It's 2 hours long. That's Tools to Quit. That's very commonly chosen because of, transportation barriers, and or someone may be ready to get in there, get the information, if the nicotine replacement therapy is appropriate for them, then they could get that as well. And then I'll move on because the other one is a private type class in substance use or behavioral health recovery setting. So it's not open to the public, but there are some groups of pregnant mothers we're working with, like Sisters in Sobriety, Mothers in Sobriety, Chemical Addiction Recovery Effort, AWARE, which is a women's recovery effort, and they have a lot of pregnant mothers in the program. So here's just some sample information if you want to try to get the message out. We've got all types of flyers and brochures that are created by the Bureau and or approved by them. And when I say the Bureau, I mean Tobacco Free Florida. And then the referral form, I can get this to you if there's something you want to use. We have fax referral, which is the form in front of you, and or they can make an automated referral link, which is generated and private to your agency or clinic. And then you could submit a referral to have your patient get access to these services as long as they're a Florida resident, and or they can be put into your electronic health records, depending on the system you have. We've done that at many clinics and hospitals across the state of Florida already. I did want to mention that varenicline is a drug that acts on the brain nicotine receptors, and several small studies evaluating its safety in pregnancy don't find evidence of teratogenicity, but data are still limited. Bupropion is an antidepressant with other limited data. This is also known as Wellbutrin, but there's no known risk of fetal anomalies or adverse pregnancy effects. So these are medications that someone can use to help them quit smoking. Both bupropion and varenicline are transmitted to breast milk. So right now there's insufficient evidence to evaluate the safety and efficacy of the treatment during pregnancy and lactation, but that's a decision that can be made amongst them and their doctor or their primary care provider or OB. And then what are approved? Well, e-cigarettes are not approved. So let's be clear about that. It's the FDA has not approved them, and they're not a safe, effective means. At this time, we can't recommend their use. If a client does come and their doctor does approve replacement therapy, they can get the 21 milligram, 14 milligram, 7 milligram patch, and we teach them how to utilize that, what's appropriate as far as how much they were smoking versus what replacement therapy they need. They are intended to replace their smoking, not to do in conjunction with. And then they use the gum or lozenge as an oral replacement. And we teach them all about how to use this. Again, if they're pregnant or breastfeeding, it is contraindicated, but they would be permitted to get this if their doctor thought that it would benefit them, versus, how maybe they smoke at a really high rate and they're having a lot of trouble with that. And in that case, the doctor may prefer them to at least get the nicotine from a different source that doesn't have all the other toxins and chemicals that like the cigarette and e-cigarette do have beyond just the nicotine. So just to kind of wrap up, the U.S. Preventive Services Task Force concluded that current evidence is insufficient to assess the balance of benefits and harms of nicotine replacement products or other pharmaceuticals for smoking cessation during pregnancy. Because trials done on this have been attempted, but many of those conducted in the U.S. have to be stopped because either data is demonstrating adverse pregnancy effects or not demonstrating effectiveness, and or because it's maybe just unethical, so they can't look at this if they know that it could cause damage to the fetus. And if replacement therapy is going to be used, it should be used with clear resolve for the patient to completely quit smoking. Intermittent dosing would be recommended first, like gum or lozenge, because it only spikes temporarily and then drops the nicotine levels back down, versus a patch is going to deliver a steady stream. And remember, we said whatever mom's taking, baby is getting. And higher concentration. So the minimal amount to be effective would be kind of where someone would be recommended to start. Again, always with the approval of their healthcare professional. But these can be purchased over the counter. So you may have some others who's going out and buying this. So it's important that you understand to tell them that this is contraindicated and can still be an issue if they're using nicotine from any source. But you do have to weigh the pros and cons of them continuing to say smoke or vape heavily versus using replacement therapy. And one other recommendation may be that normally someone would wear, who's not pregnant, a patch for 24 hours and change it every day. So with a pregnant mother, they may say wear it up to like 16 hours so that they have less time exposed. But again, that's a decision that the doctor has to weigh in on and approve. I just wanted to display, I know I started out by saying where we serve, but these services are available across the state of Florida. There are 10 nonprofit AHEC centers that are affiliated with the colleges of medicine across the state, and all 67 counties are covered. We do education to community providers and healthcare students, healthcare providers. And these are just some of the topics. They always relate in some way to tobacco because that's what our funding is for out of this particular program. And then lastly, since I have you here, I have to mention some of the other free services that may apply to the clients you serve. We have several free programs, but these two are our navigator program on the left, which we have many certified health insurance navigators in our office to help individuals and families who qualify for health insurance via the federal health insurance exchange. We don't buy or sell health insurance or pay for it, anything like that. We just help them enroll. These plans can be a little bit complex, confusing. There's so many options. We help them through the marketplace. And if they don't qualify, we can help refer them to Medicaid or Medicare or Florida Kid Care as needed. And then we also have this diabetes program called DEEP, or Diabetes Education Empowerment Program. It is evidence-based, and both programs are free. So they're excellent free resources across all the counties we're serving. I'll end it there. I'm sorry I ran a little long. I want to leave the rest of the minutes for questions. I will stop sharing. And if you need my email, I can pop it into the chat. So I know it was a lot. It was fast, and we only have 5 minutes, I guess. I apologize that I ran over.
Oh, we're perfect. That was great. That was a lot of great information. And Emily, I would love to take a deeper dive too into smoking and preconception and effects on women and men at a later time. But does anybody have any questions for Emily? No questions.
Anything surprising? Anything shock you today, or anything stand out? Is it interesting at least? Someone said I learned a lot. Thank you. I did too when I was researching for this. I can share a PDF of the slides. That's what I'm permitted to do. So
thank you.
Should I send that to you, Chris?
That would be great, and we'll get it out.
And if you would like to leave your email so anyone can contact you, that would be
Absolutely. Especially if anyone's interested in the e-referral, to send referrals for the program. I'm typing it in now.
So Emily, I learned a great deal today. Thank you. Keisha, who is a doula, said as a doula, information was much needed. Thank you for sharing.
Awesome. Thank you. We used a doula during our pregnancy. We're actually trying again next week. So hip hip hooray. What an appropriate group to tell that to, right?
That's wonderful. Well, we're here to help.
Thank you. Yeah, appreciate that.
All right, wonderful. Any other questions or comments? All right. Well, Emily, again, thank you. I appreciate you presenting today, and I do want to circle back with you on that preconception health piece as well.
Great.
Thank you to everybody who was able to join us today. We will be sending a recording of this presentation out as well, and our next Lunch and Learn is going to be on April the 5th. Our topic is doulas and their role in supporting pregnant women, and the presenter is Keisha Jenkins. So registration information will be coming out in the next week. Thank you, everyone. I hope you have a safe, happy, restful weekend.
Thank you so much. Bye-bye.
Thank you.